Well, welcome back to the News at 9. In today's Health Yes with Genesee Health Plan, we're talking about veterans health care resources. So joining me now, Jim Milanowski, President and CEO of Genesee Health Plan, and today Jacob Bennett, Deputy District Director for U.S. Congressman Dan Kildee. Thank you both for being here. Today's topic all about how veterans can access resources available to them and really find out what they qualify for. So, why is this such an important topic in mid-Michigan, and how large is our veteran population, if you know a general number?
Well, Michigan, there are about 670,000 veterans and about 20 million or so nationwide.
Sure.
And it is important because healthcare is confusing, period.
Yes.
Whether they come to us for healthcare or veterans, and so it is an important topic to know where you can access services and where to know about your eligibility for services.
Right. What is the presumptive illness benefit for veterans?
Presumptive illness is mainly where the VA assumes, based on a medical condition that you have, that it's based on something you happened to you in service.
Sure.
And it's tough sometimes to tell whether one thing is because of the other, but they just presume that because you were in the service, you were exposed to this condition, then this condition is because of your military service.
And they can get a higher benefit level, is my understanding, if they qualify for this presumptive illness. So it's something for a veteran to look into.
So why is this important to Genesee Health Plan? How do you guys tie in?
Well, a lot of veterans come to us, and sometimes they're like, we'd rather be on the Genesee Health Plan than VA services because, again, it's just so challenging and daunting.
Yeah.
So we help assist people veterans get to where they can get more information, more resources. And we just started we've talked about this on the show, a dental benefit that we use for seniors, but we can also use for veterans as well. So if they don't qualify for dental services in the military, we can help them out as well.
Wonderful. Where can people get more information about services like this for veterans?
A great place they can go, well, first of all, they can call our office. We have a lot of resources. We can point people to the right places. The other way, we usually reference a lot of people to veteran service organizations like the VFW, American Legion, Purple Heart. These guys are certified by the VA to help fill out forms, things like that. And then once they send those forms in, the Congressman's office can come and help make sure these things go through the process without undue delay. Sometimes, if it needs to be expedited because of a dire need, we can help with that. But those are the great places to start off with.
Okay, wonderful. Now, are veterans only allowed to go to VA hospitals for care? That's not the case, right?
No, there are some instances, but for the most part, you have to get pre-approval from the VA. But there are places that you can go outside of the VA if there's not enough time or they don't have specialists in the area, things like that.
It's called Veterans Choice, and you have to get pre-authorized to do that.
Okay, so any advice for recently discharged veterans?
Absolutely. I have a lot of friends who are in the military, and when they're getting out, the best thing I tell them is to keep copies of everything. You can bring your DD-214, your discharge document, typically to the clerk's office, and they can keep a copy as well. But keep copies of your medical files, keep copies of everything, because things can get lost, unfortunately. So that's be my biggest recommendation, and apply early. Apply as soon as you get out, start the ball rolling, and start those process there.
Wonderful. All right, thank you both for being here. Now, if you want more information about today's topic, which is health care for veterans, log on to the TV5 Facebook page right after the News at 9. We will be live there to answer your questions.